This vignette, we'll be talking about setting up airway equipment. I'll cover endotracheal tubes, laryngoscopes, airways, securing the airway, and bite blocks. So, we're going to start with your personal protective equipment, which will include goggles, gloves. You want to make sure you have a stethoscope and the other things that you need for your anesthesia, but we're focusing on our airway right here. We're going to look at the endotracheal tube. You want to select appropriate size endotracheal tube for your patient. For females, average of 6.5 to 7, male 7.5 to 8, and for pediatrics, you calculate that size and you have one above and one below. So you select your endotracheal tube, connect a 10 cc syringe to it, inflate the balloon with air, squeeze to make sure it can hold that pressure, the balloon is intact. Take your air out again, get your stylet, slide in your stylet, and make sure your stylet doesn't go past your Murphy's eye. Okay, then you put this back in your package and make sure that stays clean. Next thing you want to check your laryngoscopes. Your laryngoscopes, they come in two different types. You have a standard. You want to make sure they have batteries. And the standard has a light attached to the blade. Little light, you want to make sure it screws into place. The other type laryngoscope is a fiber optic. You can tell the fiber optic, it has a green line, and the handle itself has a green dot. So, you want to get your laryngoscope, make sure you attach the blade to the handle, make sure your light functions on all your blades that you're using. Okay, the Macintosh blade, the Mac, fits into the vallecula and it lifts the tongue, the base of the tongue, and the epiglottis. The Miller blade, the straight blade, fits right under the epiglottis and it will lift to give you visualization of the cords. The other thing you want to make sure you have oral airways, assorted sizes, a tongue blade or two, nasal airways, soft bite blocks, and the hard bite blocks are the oral airways. As far as insertion of an oral airway, this vignette has been setting up airway equipment. We've covered endotracheal tube, laryngoscope, airways, securing the airway, and bite blocks.